Good morning. My name is TusaRebecca, and I'm going to walk you through current eating patterns in the United States. We'll be focusing on young children ages 1 to 8 years and adult women 19 to 50. And I do recognize that the age range for children exceeds the age range of participants in WIC, and the age range for adult women may not capture some of the younger mothers. In this figure, we can examine the current eating patterns in the United States for the total population ages 1 and older. And we see the different food groups: vegetables, fruit, total grains, dairy, protein foods and oils, and then added sugars, saturated fats, and sodiums from top to bottom. And the orange bars represent the percent of the population that is either not meeting the recommendation at the top, or exceeding the limits for added sugars, saturated fats, and sodium, illustrating that our population has dietary intakes that do not align with the recommendations in the dietary guidelines. So for the remainder of the slides, I will be showing data for the different food groups, and we'll be looking at the data in two ways. We're going to be looking at the percent of population that is below the recommended intakes, as well as where average intakes fall in relation to the ranges of the recommendations. So we'll start with total vegetable intakes. The blue bars represent the range of recommended intakes of total vegetables for the calorie patterns that are assigned to these age sex groups. The orange boxes are circling the children, males 1 to 8 on the left, females 1 to 8 in the centermost box, and females 19 to 50 on the right. The orange circles represent population average intakes of total vegetables, and we see that they fall below the recommended ranges for these population groups. So what percent of young children and adult women are meeting the vegetable food group recommendation? Not very many. So over 80% of young children and adult women have dietary intakes of total vegetables that fall below the recommended intakes. We can examine further to look at the percent of the population intakes that fall below the recommendations for each of the vegetable subgroups. We've got dark green vegetables at the top, then red-orange vegetables, beans and peas, starchy vegetables, and other vegetables. And this figure only shows the percent of population ages 1 to 3 and 4 to 8 years. And again, we see that for all of the vegetable subgroups, a large majority of the population of young children in the United States have intakes that fall below the recommendations. The same really applies for adult women. Again, we see that a large majority of the adult woman population falls below the recommended intakes for each of the vegetable subgroups. Looking at fruit intakes and the recommended ranges, again, the recommended ranges and the blue bars, and the population average intakes represented by the orange circles. You see that for young children, intakes actually fall within the recommended ranges of intakes. However, for adult women, the average intakes fall short of recommendations. Again, looking at the distribution of intakes in the population, for young children, a larger percent of the population is meeting the recommendation for total fruit intake, whereas adult women, about 80% of the population is falling short of the recommended intakes for total fruit. This figure shows population average intakes for total grains, and for young children, the total grain intake falls within the ranges of recommended intakes. For adult women, the average intakes fall at the bottom end or just below recommendations for total intakes. But we'll look at this considering only whole grains, remembering that the recommendation is that half of total grain intake should come from whole grains. Virtually no one is meeting the recommendation for whole grain intake for children or adult women. So another way to think about that is nearly all of the total grain recommendation is coming from refined grains. Looking at dairy intake and recommendation, for the youngest children, ages 1 to 3, population average intakes do fall within the range of recommended intakes. For children 4 to 8, boys here on the left and girls on the right, intakes do fall below the range of recommended intakes. And we see that for older children and all adults, dairy intakes fall below recommended ranges. And to look at this as looking at the population distributions, for boys and girls ages 1 to 3, a little over 60% of the population in that age group is meeting the dairy recommendation. However, for boys and girls ages 4 to 8, over 60% of the population is not meeting the recommendation. And nearly no adult women meet the recommendation for dairy intakes. So here we have protein food group intakes and recommendations. For the young children, the population average intakes do fall within the recommendations for protein foods. For adult women, average intakes fall at the bottom or just below the ranges of recommended intakes. And the next slides will look at the protein food subgroups and the population distribution of intakes for those subgroups, where seafood is at the top, meat, poultry, and eggs are the bars in the middle, nuts, seeds, and soy products are the bars at the bottom. Very few children or adult women have intakes of seafood at or above the recommended amounts. So this figure is a little bit different from the previous figures. The blue bar represents the 10% target on added sugars. The yellow circles again represent the average percent of calories from total energy intake for each age sex group. The youngest children, ages 1 to 3, have added sugar intakes that are closest to meeting that target of 10%. However, we see almost a bell curve of sorts, where for children ages 4 to 8 and for adult women, the percent of calories coming from added sugars is over 14%. And also remembering Eve's illustration that for many of these calorie patterns, the remaining calories for other uses doesn't allow for over 10% of calories to come from added sugars. Again, for saturated fat, the blue bar represents the target for 10% of total calorie intake from saturated fat, and the yellow circles represent population average intakes as a percent of calories. The youngest children actually have the intakes about 12% of total energy intake from saturated fats. The adult women come close to meeting the target of 10%. So again, shifts need to align with healthy eating patterns need to occur. The USDA food patterns include amounts that reflect eating patterns associated with positive health outcomes. For vegetables, most young children and adult women fall short of the recommended intakes. For fruit, average intakes among children fall within the recommendations. However, adult women have intakes that fall short of recommended intakes. For whole grains, almost no one is meeting the recommendations. For dairy, only 1 to 3-year-olds have average intakes that fall within the recommended ranges for the dairy food group. And for protein foods, a large majority of the population falls short of the seafood recommendation. So with that, I'll thank you for giving me the opportunity to share this data with you. And we have some resources on this slide for more information of resources that we provide, and I think we have plenty of time for questions.